Thank you very much for inviting me to talk. I'm really excited about this subject. It's been quite close to my heart for the last year or so, actually probably longer than that, and it follows on quite nicely, so thank you. You did a very good synopsis earlier, so I kind of sat there thinking, I don't really need to do this, but here we are. So, Chlamydia Digital Pathway. So my name's Kirsty, Roseaman. I'm the matron for Sexual Health Services in North Hampshire, which is Hampshire and Isle of Wight NHS Foundation Trust. We've merged with other services recently, so we used to be Solent, but we're now Hampshire and Isle of Wight. So what I'm going to be covering today is actually what is Chlamydia Digital Pathway, the challenges we found, the solution, implementation, and some of the metrics we measure our service against. So first of all, what is Chlamydia Digital Pathway? So as Andrew's already said this quite succinctly, but Chlamydia Digital Pathway was in the pipeline for some time, initially planned pre-COVID with us, but understandably with Parks during the time that COVID was happening, so allowed the service to focus on managing a service during COVID. It provides the ability for patients to undertake an eligibility assessment for self-managed chlamydia treatment online through their personal health record. It also provides a more streamlined process for patients to access their chlamydia treatment and allows patients to have their treatment posted to them at home or to any other preferred address. So within the system, patients can say which is their preferred address to have their treatment posted to. Quite useful for uni students because they might have registered with mum and dad's address, but they're actually living somewhere else, so they can have it posted there. They can also have it, so they can come and collect it in clinic, but most of our patients have it posted out. It also supports some basic PN, including provider referral, and that's been a real positive for us because we've seen a really marked improvements in our provider referral rates through this pathway. I think patients prefer to do that slightly more anonymised discussion of who they've had as sexual partners, and they are more readily giving us information through this process rather than doing it on through telephone calls or face-to-face. So the challenges we've had, so as a service we've had some huge challenges over the last few years because we've got a new contract. So we went out to tender a couple of years ago, been a new contract since 2024, and we were changed to a block contract. So as you can imagine, that gave us a fixed financial envelope and not much scope for innovation, but we're having to be very agile about how we manage our money. The constraints on our estate footprint, so we had quite a lot of large estate within our service, and where we're now on block, we had to reduce our estate's footprint, so we reducing in effect appointments face-to-face. So we needed to find some solution for managing patient care. With a very fixed clinical staffing resource, and staffing is an expensive part of our service, so we need to make sure we're using it to the best ability and using it really effectively. Difficulties with access to appointments. So we use a telephone system where, and I'll touch on this in the systems thinking better in a second, where our patients phone up, but our demand for appointments through our call system far outstrips our ability to answer the phone. And it's an ongoing issue we have within service that we can't get to everybody. So providing different ways of patients accessing our service is what we need to look at. So we need to look at how we can work smarter, maximise the efficiency of the service, embrace new ways of working which support patients to access care they need in a more streamlined way without even needing to attend clinic. We were already managing treatment by following clinical conversations over the phone, so this process we've put in place is a next step on from that. And we want to be utilising more digital processes to manage all our patient care. Systems thinking. So systems thinking is something we've adopted as a service. It's a new way of working using the Vanguard method of systems thinking. It's allowed us to look at our processes and pathways in a very different way. And it's identified inefficiencies in current processes and the need to make change to make sure the work we do is value work and not waste work. We were quite surprised when we undertook the assessments for this, that actually a huge amount of the work we do historically is waste work. So just a little bit more about systems thinking to kind of phrase this for you. So systems thinking, our service is designed and managed using the Vanguard method of systems thinking, which is placing its customer, or in our case the patient, in the forefront of the service it delivers. The service is designed to ensure that the patient journey is patient-focused, personalised and clinically effective from the first point of contact. When patients contact our service, they speak to a trained nurse who will assess their needs and ensure the patient is booked in with the most appropriate member of staff has an appropriate length of appointment time, should an appointment actually be required, and quite often we can manage things without even booking an appointment. And we are providing the clinical and practical advice required to maximise the quality of their care. We do our utmost to ensure that the appointments are booked at times and on dates that fit in with our patients' lives. Meaningful data allows us to measure, assess, and respond to statistically significant variation in real time, enabling us to make changes to the service we are providing with agility. We now have no KPIs. It's a positive, isn't it? Everyone loves a KPI, not. Okay. So, systems thinking, the fact that we've identified through our systems thinking process that we need to be more agile and we need to work more smartly has supported our introduction of the Chlamydia digital pathway. So our solution to all this was to develop a pathway via PHR to enable patient access to be more remote. So more convenient for the patients. They can access via their PHR anytime. It can be 2 o'clock on a Saturday morning, whatever they want to do it. They have it at their fingertips. It's confidential, it's a secure platform, and it's much more anonymous. And that's been a real positive for our PN rates that we've seen improved. There's no need to attend in person, and there's a better use of clinician time. The chlamydia treatment itself, we're already posting treatment out by following telephone consultation, so there's no great change there for us. It's a standard dose, very few contraindications, and it's provided by prescribers or PGD, staff using PGDs, which are in place, and the PGDs have always signed up through our medicines management group. So, implementation. Training was provided to a pilot group of nurses and health advisors. We initially wanted to do it as a pilot in one locality only because we wanted just to check out how it was working before we opened it up to the broader service. Having done the pilot, we've now decided to leave it within that one locality because they are managing the amount of patients coming through on this pathway perfectly well. So rather than expanding it out and making it more likely to break, we find it's better to keep it as a small group and one locality managing it, which they're doing really well. Go live, and it was the first of type, I think, wasn't it? Yes, first of type PHR module started January 25. However, we were tinkering around with it for the kind of November and December just before that, just doing with a few patients just to make sure it was working. Lessons learned, we're learning lessons all the time. And I think one of the things we didn't do initially, we just did it for genital site infection. And now we're thinking about extending it out to include rectal and pharyngeal, because if you don't include rectal and pharyngeal, you're cutting off quite a large swathe of patients that are coming through the service with positive results. Development and review is something that's an ongoing process, as it is with any digital innovation. Think about looking at adding in more infections, like maybe MGen treatment. Looking at Andrew, smiling. But obviously that's something we need to work on moving forward. And data review, we review our data all the time. We review it every month as part of our systems thinking reviews as well. And it's giving us some good results. So, my pathways aren't as pretty as Andrew's, but there we go, I had a go. This is the pathway. Now, it's really a really straightforward process. And I have to say, patients love it. And as clinicians, we really love it too. So you've got your patient initially at the top there who completed their online test, or a level 3 service test, and they've come back with a positive chlamydia result. The result is then texted out to the patient, and dependent on whether they have a PHR or they don't, will depend on which pathway they follow. If they have no PHR, they would generally be managed with the normal process that our health advising team fulfill. However, at that point in time, we would encourage them and invite them to create a PHR so they can then be managed through the actual PHR digital process. If they don't want a PHR, then we'll just manage them through the normal service. So you've got a PHR. The health advisor then invites the patient via their PHR to complete an eligibility assessment. The patient then goes on to complete the assessment. Once the assessment is completed, a task will drop into a work list within Inform that we access to review the patient notes. And dependent on what the answers are to the questions within the assessment will depend on how it's flagged up within the work list. So the reviewing clinician is allocated working time within their working week. So we generally give nurses a 1 hour or 1.5 hour block of time within their clinical time where they will be purely looking at the chlamydia digital pathway. And they'll go into the notes and they'll review the patient's assessment. Now, where there's no issues identified, no contraindications, so coming along this top line here, the nurse would then manage that patient and post out the treatment. If at any point in time within the clinical assessment the responses indicate need for a discussion with the patient, then the nurse will then call the patient, coming down here, I need a pointer, don't I? Call the patient, confirm eligibility for treatment. If there's no issues, then they will go on to post the treatment. A lot of the things we find within that one where we have to call the patients is they've ticked something on the assessment, because when you design it, you think, that's really obvious, they're going to understand what that question means. They really don't. So classic example, things like, do you have any allergy to any medication? And they'll say yes. And then they won't tell you, which the next step is, what's that allergy? They don't fill it in. Or they'll say, there's a question on the assessment that says, have you developed any acute abdominal pain or abdominal pain since your chlamydia test? Quite often they'll say yes to that, but actually what they have is period pain. So the need to phone them up is actually more often than we initially imagined. But we can manage those ones, and obviously within those situations, then we can post out the treatment. If they're not eligible for the pathway, so for example, they've developed new symptoms, they've tested too early, or they may have already accessed treatment online themselves from an online pharmacy, then we would arrange alternative management. What I forgot to put on there was about the PN. So as part of the assessment that is fulfilled by the patient, there's a section where they're allowed to they ask to fill in about their PN. So the partners they've had contact with, and there is the option for them to identify if they'd like us to manage it as a provider referral for them. And as I said earlier, we've seen a huge increase in provider referral through this pathway alone, which has been really positive. I've got a few screenshots now. So top left, that's just, so the work list that it drops into is called PHR Self-Managed Chlamydia Treatment. That is reviewed every day by a clinician, sometimes two clinicians, dependent on the day of the week. So on a Monday, because lots of our online results drop in on a Monday, we can have quite a lot of results appearing, so we would have more than one person managing them. And then we'd filter out to the relevant stages, so the chlamydia awaiting dispatch and PHR clinical review. There are other options on this list, so there's a health advisor review option as well, which the health advisors manage. Underneath that, we've got just an example of the message that we send out. So when we are inviting them to the pathway, we send this message out just saying we've identified that you require chlamydia treatment and explaining the process to them. The link is live for 48 hours, and after that point in time it's closed and they need to contact the service. Another slide. So PHR Care Template is what has been developed to manage this, and it sits in the left-hand spine. There's just a little picture of there, what it looks like. I'm so delighted it's going to be alphabetical. You cannot know. That's just made my day. The larger screen is what a PHR Care Template looks like. So it's a screen that's split into two halves. The left-hand side of the screen is the assessment that the patient has done and the responses that they have completed. So this automatically filters into their informed record. So when you're reviewing that patient as part of the pathway, you can see that they've said they haven't got any symptoms, they're not taking any medication, they're not allergic to anything. So the clinician is reviewing that assessment. Assuming that it fits and there's no contraindications, then the clinician can go ahead and provide their treatment. So we've got communication tabs, tasks and clinical notes on the right-hand side. So when you click on those, the clinical notes bit will provide all the information that's already pre-existing in their informed record, so you can see what clinical notes have been put on there before. You can add clinical notes in on this page. I think we're just getting a PHR added into the communications tab on this, which will be really helpful. So you can document everything in that page. So you've got it's a nice succinct view of the patient care from what the patient said and then how we've managed them. So we complete that for every single patient. If patients don't fulfill or don't complete the assessments, we do follow them up after their 48 hours and chase up to make sure they haven't been lost to follow up. But so far it's working really well. So just a little bit about numbers of people we've seen. So we started properly in January this year. So we have seen a steady increase and quite steady numbers of patients coming through each month accessing the pathway. The outcomes we look at, so we had 1,224 patients using the pathway, being invited to assess this way. 254 of those did fail to assess, and the most common reasons was that they'd already accessed their treatments online from another pharmacy, or they'd been into service somewhere else, or they didn't want to do it this way, they wanted to come and see someone in person. We have nobody lost to follow-up, which was really important to us to make sure we didn't lose anybody. So our health advisors do a wonderful task of every day going through checking our fail-safe work list to make sure no positives are missed. So it's been a real positive, and we've had 812, I think, that have actually had their treatment dispatched over the last 9-10 months. So it's been a really positive experience for us. Patients really, really like it. The clinicians really like it, and it really streamlines and it gives you that focused time to manage the chlamydia treatments. The health advisors really love it because the PN rates are really going through the roof, and everyone's, really pleased. So that's me. And